Ladies and gentlemen, boys and girls, my name's Benson. What's yours? Joined by the lovely, the magical, my wife Christin. I did not forget your name, calm down. So on Thursday, Christin found out some good news, and then it was really confirmed on Friday. And what's going to happen is that she's been in the same process as me as far as trying to get the bariatric surgery, and she officially has word that she is good to go, and she's actually scheduled for surgery September the 12th. Yep. Which is 2.5 weeks.
Well, so, 2 weeks from Wednesday, yeah.
Yeah, 2 weeks from Wednesday. So we're pretty sure she'll start the 2-week liquid diet on Wednesday. We haven't gotten official word from the doctor yet. We're still waiting to hear from them to finalize some of the details. But she goes Wednesday the 12th to have the bariatric surgery. And basically once she starts this whole process, as far as the liquid diet and all the different stages, I'm going to do them right along with her, so she has somebody to kind of go through this with, somebody she can kind of talk to as far as like they'll understand right then and there what kind of the feeling she's going through. It'll be a little bit easier for me because I've already had it, and it won't be, for me it's not going to be as like annoying, I think, as it's going to be for you.
You're not going to be starving?
Yeah, because I don't, yeah.
You're not going to be hangry.
Right, I shouldn't be. Now, I mean, the difference is it's been almost, 11 months since I've been back on actual food, so there's still that, like, ritual to it that your mind associates with food, like the actual act of eating and stuff. But I don't think I'll be hangry, as you put it. But either way, it's kind of it'll be an interesting process for us to go through, especially to go through it together. So, but I guess what I'm really interested in is how you're feeling. So I've given you a couple days before we sat down to do this for it to really kind of like sink in that it's happening. So my question to you is, 3 days knowing, what's on your mind?
I mean, nothing. I'm ready for it to happen and be over with. I mean, I'm scared, but I think that's just normal feelings up until, it happens, and then once it's done. I have kids, so I'm scared. It scares me.
Right.
To do anything like that. I mean, I told parts of my family that I don't even talk to that I am having surgery because it freaks me out.
Yeah. Which, I mean,
that's being 100% honest.
Yeah, and I went through that same emotion because for me, it was my first, like, surgery, like, big hospital stay. I mean, you've worked out 2 kids.
Yeah, technically I've had surgery, but I also weigh more than I did when I did that both times. So for me, the risk is a little bit higher.
Right.
Like in that aspect, because I have a high chance of like having blood issues and stuff like that because I'm bigger than I was then.
Right.
But, so if I'm being 100% honest, that's the main thing right now is just remembering to calm myself, I guess, kind of.
Right.
And not scare myself out of wanting to have it done.
Right.
Because the reward for having it done outweighs the scary feelings.
Right.
That makes sense.
And we've made sure to go through a doctor who is very professional and has done this a ton of times.
Yeah.
So.
Yeah, and I mean, I know other people who have had it from the same doctor. I know other people who have had it from other doctors. And I mean, I have other people too, not just you. I have a friend at work who's had it. And, so I mean, I know I kind of can, you're very like by the book and, you do everything that you're told and that's it. That's it. So my friend at work doesn't always necessarily do everything she's supposed to do. And so I get to see both sides of it.
Right.
If that kind of makes sense.
Yeah, I mean,
there are things that you miss.
Right.
Like, sometimes you forget to take vitamins or whatever. But, like, as far as food goes, you don't stray from what you're really supposed to be eating. Whereas, like, other people I know that have had it do. They eat things that they probably shouldn't be eating. Milkshakes, stuff like that messes their stomach up. So I get to see, like, because you haven't had any of that stuff happen. You haven't had dumping syndrome. You haven't, you haven't been so sick from overeating that you can't function. You haven't been like that. So I've gotten to see that in other people because you never had that. So I didn't know what to expect about that kind of stuff because you never did it.
Yeah,
even though it's a possibility.
Well, it happened to me one time. Like, right after they put me on solid foods, probably a month after solid foods.
But it wasn't necessarily dumping syndrome.
No. I've never experienced that, which is because I'm afraid to eat.
But that's okay. There's nothing wrong with that. I'm just saying, you hear about all the stuff that can happen.
Yeah, and it's weird for me because I haven't.
They say 99% of people experience those things, regardless of whether you're following the plan or not, and you never did any of that.
Right.
So you never had the like I said, you never had the dumping syndrome. You never overate to the point of...
I had that. That's the one time I'm talking about. About a month after I hit solid foods, we had hot dogs, and I ate too fast.
But that's eating too fast, not overeating.
Well, so it because I did that, it became an overeating situation where, like, my stomach was just and it wasn't even the hot dog, it's that I ate it on bread. And bread's not a bad thing. You can have bread in moderation, but it was my first time eating bread, so it was my first carb in, like, 5 months. And it knocked, like, I went to sleep, it hurt so, like, my stomach hurt so much, like, and after that, like, I've been very cautious about how I eat and what I eat, because that one time was enough.
And, you had, like, the corn incident, but that wasn't...
Oh, yeah,
that wasn't
something got
not following the diet.
Yeah, no, it got hung up. I've had that happen 3 times.
Well, I knew for sure about that. But what I'm saying is you never did the stuff that they said would happen if you don't do what you're supposed to do.
Yeah, I stay away from greasy foods.
You don't use a straw. You don't drink soda.
Right. I don't drink high sugar drinks.
Yeah. If you drink alcohol, it's very minimal.
I waited a year.
Yeah.
And it's really bad for us because we're on a YouTube show every 2 weeks. Drunken Diz Twits, where we watch a Disney movie, get drunk, and then talk about the movie.
Yeah, but I'm not ever really drunk.
Yeah, no. And that's one of the other weird things, too, though. Prior to surgery, I could bottle an entire bottle of 151 Wild Turkey down and walk a perfectly straight line, be perfectly normal.
And it takes a lot for me to...
Right, and you're in the same boat. So post-surgery, most people have told me they can't even get to 1 shot.
Yeah, a friend of mine drinks half a margarita and she's loopy.
I work with a girl who's like, 1 shot and I'm done. Yeah. And, on that show, I've gone through 6 or 7 shots within the span of 45 minutes. Mm-hmm. And I can feel it now, which is a very new, fun sensation.
Yeah, but you're not drunk.
Yeah, it never... Now, imagine if I was, like, pop them back to back to back to back. But I think my body's burning them off in the span of the time.
Yeah.
But, so,
that'd be interesting.
Yeah, it'll be interesting to see it from your standpoint, like, to watch it happen for you, like, to see what your new tolerance is when that time comes.
Yeah.
But, yeah, so it's... And you've told me stories about it, and some of the girls that I work with, they've had it, and they've talked about their stomach hurting so bad that they get dumping syndrome. But for them, sometimes it's not even necessarily a food issue. It's they have other issues too. So
yeah, well, but that's what I'm saying. So like, you never did any of the stuff that you weren't supposed to do in order to have those kind of side effects. But I know people who have, or I've seen it happen to some people, and so it's kind of good. It's nice to see both sides because, like, you know, like I said, you're different. You're not commitment, but your willpower is a lot stronger than mine a lot of the time. And I mean, I don't think I'm gonna have that problem, but you know, it's good to see it firsthand so I know, okay, I'm not doing that.
Yeah.
You know, because you can hear about it all day long. It doesn't necessarily mean that you're gonna be like, that's enough to keep you from doing it.
Well, what I think has helped me, so I mean, it's been a year. Officially, it's been a year.
It was a year on the
24th? Was 26th? Okay.
Maybe it was the 24th.
No, it was the 24th, because are we at the 26th yet? I don't know. Yeah. So for me, the biggest thing is at no point have I...
had the desire?
No, I don't deny anything. So like if I want something sweet, I'll eat something sweet, but I either design my own alternative, the sugar-free cheesecake, pumpkin cheesecake, that instead of putting on a cookie crust, I put it on a pumpkin base. Yeah. Texture's a little goofy, but it tasted just fine.
Yeah, it was good.
So I think for me, that's the thing, is I
can't get over Splenda though. That stuff is nasty.
Well, and that's fine, but see, you're okay with like unsweet green tea and stuff like that, and I've gotten a lot better. I don't drink near what I used to drink. In fact, I mean, maybe in like the sugar-free Gatorades and stuff that we get now. But I've learned that I'm never going to succeed if I refuse to eat any carbs, I refuse to eat any sugar. You know, I'll buy juice, but I severely water it down where it's just like a flavor there.
Yeah, but on the days I don't eat carbs, I feel better.
Yeah. Well, so the thing is too about carbs is it's a moderation thing, because you need carbs. Carbs are your brain food.
Well, that's why I haven't just cut them out completely. But
and you can't, because the carbs feed your brain, so if you don't get carbs, then you start feeling tired all the time because your brain can't function. So I've just found better carbs like oatmeal and...
Well, yeah, there's a better way to get carbs as well.
Right. High nutritious grains and stuff like that. So it'll be interesting, because I've basically decided that, you know, starting Wednesday, I'll pack your lunch and my lunch the exact same way. We'll have the exact same stuff.
Sorry.
You know, I mean, I want to do it to help you. You know, I know it's going to kind of feel like I'm mother henning you, but it's really just to kind of...
No, I need their structure.
Yeah.
Because we also found out, going through this process, that I have ADHD.
Right.
So structure helps that.
Yeah. Well, and the thing too is, as much as you love your friends at work, they're not always the best influence, we've heard. So that's
why I said I've seen it from both sides.
Right. So us doing it together, you know, if you ever feel like you need a cheat, you can call me or talk to me, and I'd be like, you know, this is why we're doing it. We got to remind you of this, this, and this. You know what I'm saying? Yeah. So that's kind of why I've decided to do it.
I mean, I don't think I'm gonna have an issue.
I don't either.
Honestly, I think I'll be okay. I mean, but like I said, right at the moment, the big thing is just being afraid of the bad stuff that could happen. You know, not bad as in after surgery, but bad during surgery. Yeah,
right.
And it was like that when I had my C-sections.
Oh yeah, too. No, we were terrified.
It's not so much that the surgery itself, it's just a surgery, another surgery.
For you too, so you went through the whole process with me, and then you started a new job and couldn't have the surgery, and I had the surgery.
And I was angry.
Right.
Well, I wasn't angry. I think I was, and not jealous, but like envious.
Right. Well, because we did it together. We started the whole process together.
Because that was the whole point, was to do it together.
Within 2 weeks, we were planning on having it, so we could do this whole thing together.
Yeah.
And then, I mean, the job is a blessing, but at the same time,
the job, we needed it.
Right.
I mean, not we needed it. it came at a time when it was beneficial because of everything we got to do because of that job. So
well, and the schedule's a blessing.
Yeah, so we have, you know, my job basically pays for us to have a second car, to be able to go to Disney, to be able to buy your equipment when you want it for the podcast and stuff like that. I mean, not all of it, but some of it. And it takes a burden off of you just being the sole provider, which you've done for 13 years.
Well, which is why it was a good idea to... We sat down and we were like, okay, this has got to happen, but we know this is going to happen. Well, there were other things too, like you end up getting diagnosed with the weird stomach bacteria that...
H. pylori.
Yeah, whatever. So, like, when you do the blood work and all the things, they have you, like, drink this medicine and blow into a bag.
Yeah.
And she's one of the very few people that ended up with it.
No, it's supposedly it's really common.
Oh, is it?
But it's like
it's like 2 months worth of treatment. Well, treatment. Yeah. It's just antibiotics.
It's
for 2 months.
Antibiotic and something else. But threw off that because you can't have that and have surgery.
Well, and then we did another big thing that was we swapped to your insurance because your insurance was 100 times better than mine.
And a lot cheaper.
A lot cheaper. And so then your insurance was like,
it required something different for the surgery.
Like, starting all over, you got to do this, and this. So